when you have a nervous system that is already sensitized and an immune system that's already disturbed, as conditions like fibromyalgia are, then the occurrence of a viral infection like COVID has a particularly bad habit in terms of sensitizing and almost oversensitizing that nervous and immune system. So it's not at all surprising, as one viewer has asked about the link between fibro and long COVID. We've had a lot of patients being referred to our clinic with a flare-up of their fibro symptoms. And in reality, it's often very difficult to distinguish between a flare-up of fibro versus the possibility of long COVID, especially if they have had a COVID infection and tested positive. For me, I would still say that long COVID has got many similarities to fibromyalgia, and therefore the treatment protocol and the various suggestions we make in the clinic for treating that would be the same, irrespective of whether we call it a flare of fibromyalgia or a long COVID-like presentation. Of course, when people have shortness of breath or various symptoms such as palpitations or sweating, things that are suggestive of orthostatic tachycardia like POTS-like syndrome, then it's more likely to be seen in long COVID, not so much in fibro. But the distinction is academic in a way because the treatments are still going to be the same irrespective of symptoms. One of the most common symptoms is, of course, pain. And in this kind of pain, often the description is such that we think it's all neuropathic, meaning that the nerves are getting damaged. And it might be like the burning pain or the stinging pain or the pins and needles or the tingling there. What we now realize is that in many patients, the nerves are not actually damaged. Of course, patients who have been having COVID in ICU, they may have some damage to the nervous system itself. But for most of the people who have had relatively mild to moderately severe infections, they've been at home and not needed to go to their GP or the hospital, these patients will have what's called a nerve sensitivity that's causing a pain very similar to neuropathic pain. So I would venture to say that in most cases, neuropathic pain in long COVID is actually a form of central sensitization. And in that sense, it's quite similar to how you would manage the central sensitization in fibro. There is the option of calming the nervous system down using drugs, but there is a great case to be made for trying to calm the nervous system using non-drug measures. And this would be looking at dietary options, this would be looking at sleep optimization, this would be looking at physical activity, and this would be looking at a variety of mind-body techniques, whether that's yoga, whether that's Pilates, whether that's Tai Chi. Think about what those options are, and I think that will give you the best bang for the buck in having a combination of these techniques. I hope that's helped you in this video there. I look forward to seeing you in the next video. Thank you for watching this. Have a good day. Thank you for watching this video. I hope you found it of value. So don't forget to like this video and subscribe to this channel and click on the bell button to be notified when the next video comes along.